Good day. I'm Dr. Lisa Taylor-Swanson, and it's a real pleasure to present this talk to you today with my dear colleague, Dr. Mary Koithan, on midlife women's health and wellness, and we're developing an explanatory middle range theory. So, our purpose is to describe this theoretical model that we're developing, and we're focusing on the midlife women's health. It's really a time of whole person change, it's biopsychosocial. And so, we're looking at this embodied whole person phenomenon and really trying to find a way to describe the perception of symptoms, the appraisal of symptoms, and then to have a way of testing a model to which we can test interventions and see which parts of the system we're improving with our interventions. So, again, thinking about this whole person phenomenon of perimenopause that's experienced during the midlife, we were informed by both Malais as well as Smith and Lear's strategies to develop this middle range theory. We looked at the literature, drew on our clinical experiences, and really built concepts based on both processes to define relational statements between concepts. And so our key findings are that we have various components of this model that include symptom experience diagrammed by the green circle on the left. So thinking about if you were to just settle into your body in this moment, if you feel, say, tightness perhaps in your back. So you're feeling, oh, this is happening again. That's a daily experience, the frequency, and it lasts all day or it's very short. So again, symptom experience. And then symptom appraisal is in the little bit lighter green circle at the bottom. So as you feel, say, tightness in your back, perceiving, oh, this really doesn't bother me at all. It's fine, or it is bothersome. Does it interfere? Maybe I can't type as well as usual if I'm having thoracic tension. How severe is this? So again, you first feel something and then you appraise it, how much it's bothersome or interfering. And then I might choose to take a self-care behavior drawn on the right circle. Maybe I'm going to do some stretching, some yoga. I'm going to do some self-massage perhaps, or gosh, it's really such a problem symptom, a bothersome symptom. I might need to go see my nurse practitioner or my massage therapist or my acupuncturist. So again, these behavioral responses can be self-care as well as going to see healthcare. And then it's important to keep in mind that there are social experiences in the blue at the top circle there that can affect our experience. So, with the example of the menopausal transition, during which pain, sleep, mood, cognitive concerns, as well as hot flashes can really be on the uptick, it can affect our symptom experience. If we have support, we can call a friend or a sister. Gosh, those hot flashes are back. Or if I'm feeling isolated. And also, in the case of the menopausal transition, stigma is in many cultures still an issue. So, again, social experiences can affect our symptom uh, appraisal and experience as well. So, I'm going to draw your attention to the top and the bottom of this diagram. At the bottom, we have real time, just ticking along. That's the same for everyone. And at the top is developmental time. The menopausal transition for some is only a few years. On average, symptoms are experienced for 7 years. But again, that developmental time varies by woman. And then lastly, this is where we're thinking of starting to tailor and target interventions to see if we can improve the symptom experience, these amplifiers and balancers on the left and right hand side. So on the left hand side, amplifiers can make our symptoms worse. We get all anxious or we catastrophize. We have a history of ACEs, adverse childhood events, experiences, trauma. Balancers can help us, take things down a notch, help us appraise things as less severe. And those would be with respect to interoceptive awareness, which is how we perceive and interocept, literally feel our body. That's compared with exteroception, your five senses to perceive the outside world. Our emotional regulation, if I have, say, a hot flash and I get really upset and flustered because I'm giving a talk, that's not going to help me feel any better about these symptoms. Whereas if I'm able to regulate my emotions and just stay calm and neutral and come back to center more quickly, that can help with my symptom experience as well. So in conclusion, we do find that this model is a really useful heuristic to help us think about key concepts related to symptom experience, appraisal, and actions taken again for either self-care or healthcare seeking. And we're really thinking about conceptualizing this in the context of the fifth principle of integrative nursing, which is to start with the least invasive intervention first. So perhaps teaching our patients how to have self-care. So maybe using acupressure for symptom management. There's some great evidence on that. Or meditation, mindfulness in terms of helping with our stress response to take it down a notch. So thank you very much for listening to my short talk. I'm really excited to speaking with you at this conference about this model and welcome your input as well as questions. Thank you again and good day.